Hello and welcome. I'm Dr. Ranjita Sengupta, cardiologist in Central New Jersey, and I am very, very excited to present this brand new show, Heart to Heart Health Chat. February is considered the heart month. Heart disease is the most prevalent cause of mortality in this country, and we are going to talk about different aspects of heart disease and how to prevent it. And today we have with us Dr. Rajiv Tayal, who's going to educate us on interventional cardiology. Dr. Rajiv Tayal is an accomplished cardiologist, a good friend, colleague, and a mentor for me too, although he's much younger than me. He is the director of the Structural Heart Disease Program at Newark Beth Israel Hospital. He's an associate professor in New York College of Medicine. He has been extensively published and is on the advisory committee of multiple boards. He has been named as the young leader on multiple interventional committees, and I am so proud and privileged to have Rajiv on our show today.
Well, thank you. Thank you for having me. It's a pleasure
Thank you
to be
for
here.
coming and giving us your valuable time.
Thank you.
So we're going to start off by a very basic question, Rajiv, that you're an interventional cardiologist, but just educate the general population what interventional cardiology means and what you do in your day-to-day practice.
Sure. So interventional cardiology is a subspecialty of the practice of cardiology that deals with not only the heart arteries, but the cardiovascular system. And what we typically do is we perform invasive procedures to treat issues that arise as patients get older in life, meaning blockages in the heart arteries, in the legs, sometimes even in the neck. It's a very exciting time to be an interventional cardiologist because as technology has changed, grown, and expanded, we're now treating people with heart valve disease and things that always used to require open surgery in ways that are non-invasive. So people are going home almost the same day, if not the next day.
And on that perspective, I've had patients who had a completely new valve placed by Dr. Tayal, and I saw him in the office walking in on day number 3. That is so unbelievable. You know, I bet I would say 3 years down the road, people would go for open heart surgery, be in the hospital for a week, then, you know, come to the office clutching a pillow so that they cannot, because their chest is hurting from the open heart surgery. And now they're just walking into the office and it doesn't feel like that they had a major kind of procedure done. Amazing. Technology is amazing and we have amazing doctors like Dr. Tayal. So Raj, as you know, heart disease is the most prevalent killer in the US and probably in the whole world. Right. And we know heart attacks is one of the major problems that we deal with for you day in, day out, right. Those sleepless nights for acute heart attacks on call. So can you just tell us what are the different types of heart attacks? And there has been some debate on media, research trials, as to whether all blockages of the arteries needs to be treated with stents, right, or is medical therapy good enough?
So coronary artery disease is the #1 killer, as you had mentioned, not only in the United States, but also Southeast Asians in particular. And there's a very large misnomer that being vegetarian alone is good enough to prevent coronary disease. Unfortunately, it kind of goes beyond that, and a lot of it relates to how physically active we are, absolutely, our blood pressure, our cholesterol, familial and hereditary factors and things like that. So coronary disease actually occurs when you have a buildup of plaque inside of the artery that causes a narrowing. So when you look at this angiogram, this is a patient that presented with an acute myocardial infarction or heart attack, and as we inject the contrast, what you'll see is a series of sequential blockages highlighted here and here. Now this patient was having a form of MI, or myocardial infarction or heart attack, where they had very severe crushing chest pain, but it was not a acute ST elevation myocardial infarction, meaning a complete occlusion of the artery. So as you can see by those images, they had very, very tight blockages, right, which caused symptoms, but did not cause a full heart attack, right, which is where a plaque ruptures and completely occludes the vessel, right, in totality.
Right. So can you tell us what you did in this kind of a patient? Would you treat medically versus you would take them to the cath lab and open up with the stent and balloon?
Right. So this patient presented with EKG changes, active symptoms that were not alleviated with medicine, and some enzymes in the hospital that were significantly elevated. So in the setting of having a myocardial infarction, stenting is actually primarily indicated in an acute fashion. So what we did next is we advanced a coronary guide wire across those blockages, and you'll see it being advanced here. Across those two blockages, you can see the severity there, after which we ballooned with a small 2.5 millimeter balloon, opened those vessels, and placed the stent. And you can see the angiographic result going through here of the stent opening up and restoring great blood flow all the way down the remainder of the vessel.
And the most satisfying part of this is the chest pain goes away. As soon as you pass that wire down and you balloon it, and the crushing chest pain goes away, right? So it is just a satisfying thing from a doctor's perspective to alleviate the pain for the patient.
Absolutely.
So when you hear about those 911, the ER calls and the heart attacks, so that's what an interventional cardiologist like Dr. Tayal is doing. He's saving lives. That's what he does. Can you just educate us a little bit about the perspective of stent in current day setting that you are doing on arteries that would have been opened up with open heart surgery a few years ago?
So up until a couple of months ago, actually, the dogma in both the practice of medicine, cardiology, and cardiac surgery was that bypass surgery was traditionally favored over stenting for patients that had critical coronary disease, meaning disease of multiple arteries, or complete blockages of certain arteries. However, more recently, there were several trials that were published that show that stents, when done correctly, meaning when vessels are prepared and doctors take the adequate measures, have outcomes that are just as good as surgery, and it's a far less invasive procedure. So patients are living just as long and being just as healthy with stents now as they were traditionally with bypass surgery.
You know, so this actually reminds me of my patient that you took care of, and you probably remember him too. Gentleman of Indian origin, walked into my office one day, thought he needs a checkup. I put him on the treadmill the next day, shipped him out to the hospital immediately, and he was going on a cruise with, I think, 25 family members the next week. And I think you ended up putting in like 5 or 6 stents, and otherwise which would have been treated by open heart surgery, I would say a few months ago.
Right.
And I think next week I saw him in the office, I put him on the treadmill, he did great, and he went on the cruise. So that is just unbelievable, right? You know, it's like this guy would have had open heart surgery, he would have had to cancel all his plans, and his life would have been probably different after the open heart surgery. He's doing great, and thanks to the modern technology of stenting that we are doing in more and more complicated cases, we are able to avoid the surgical mortality in these kind of patients. So if you are joining us right now, we just went over some of the very interesting stuff that he does, putting in stents, opening up blocked arteries, and now we're going to go talk about how to keep those arteries open after you've had a stent in them. So Raj, after a patient has a heart attack, what do you advise to them regarding lifestyle modification?
Right. So that is actually one of the primary mechanisms of preventing recurrent heart disease. And it's very, very interesting. So what we typically do is we strongly recommend adjusting diet to the fact where there's been a lot of stuff in the literature now suggesting that converting and reducing the amount of animal protein that's ingested, particularly red meats, will reduce your cholesterol profile, reduce the inflammation, and possibly prevent the recurrence of coronary disease. Although it's not totally mandatory, because there are several ways of being a very bad vegetarian.
I agree.
So it's also a misnomer to say that I'm a vegetarian and I can't have coronary disease, because people can eat fried foods, cheeses, things like that. But basically what we want to aim for is the reduction in foods that are high in saturated fat, high in cholesterol, and high in other things that cause inflammation in the body.
Well, that's a great insight, and I completely agree with you about the recent studies about the animal protein. And sometimes, it's very hard to just convert from, having animal protein to having like no animal protein. It's a drastic kind of diet is hard to stick to. I mean, just put yourself in that perspective. Like,
Absolutely.
if I want to go completely vegan, it's hard to do it right away. I tell my patients, take a stepwise approach. In life, everything in moderation is fine,
100%.
right? That is applicable to anything in life. So after a heart attack, you do have to take your health in perspective. And in order to do that, look at your diet, maybe sit with a nutritionist, go over your diet plan, ask them what you're eating, is this the right thing to eat or not? There's been a lot of data about animal protein, but again, medical literature keeps changing. Read it, talk to your doctor about it, what is good, what is not good. And again, everything in moderation is okay as long as you're not having beef or steak like every day, right? And again, that vegetarian diet, all vegetarian diets are not good. If you're having ghee and butter every day with your parathas and your rice, that's not a good thing either.
Right.
Exercise. When do you recommend patients to go back to exercise after having a stent or a heart attack? What kind of exercise? What do you think about cardiac rehab? Do you recommend to your patients a lot of the times about cardiac rehab or not?
Absolutely. And so I've seen a number of patients go on these wild, crazy diets like paleo,
Oh my God,
veganism, and life is a pendulum. So if you go too extreme, you have a tendency to rebound and swing in the opposite direction. So it's all about living life in stages, as you so appropriately mentioned, and kind of taking things step at a time and finding a middle road. I think reduction in carbohydrates is very, very important also, but having a balanced diet overall. A lot of times as cardiologists, we focus strictly on cholesterol and say we have to get your cholesterol below 70 for your bad cholesterol or LDL after a heart attack, but we also need to pay attention to blood sugars and things that are also very, very important to the development or prevention of coronary disease. In terms of cardiac rehab, it's really funny. I was very skeptical at first, and you have a couple of patients that go through it, and you see it changes them.
Absolutely.
And usually it's the big, burly, hunky guys that work out all the time that say, "Oh, I don't need it." But there have been studies that show that it improves how people live and how long they live if they go through it, whether they feel like they need it or not.
And what I've seen that is it gives them a little bit of a confidence, because after having a heart attack, they are like, oh my God, if I get on the treadmill on my own, what if I collapse in the gym or collapse at home? So if they go to cardiac rehab, which is like a little bit of a monitored setting, there's a nurse who's checking your heart rate, your blood pressure, your EKG, you're slowly kind of ramping up your exercise. That gives them the confidence that, what, my doctor opened up my artery and I'm doing pretty good when I'm on the treadmill and the nurses are monitoring me and I feel good. And that gives them confidence to go back to exercise on their own.
That's exactly right. I think one of the most infrequently spoken about issues related to coronary disease or having heart attacks is the psychological aspect and recovering after the event. How do I deal with my life? How do I look at my children, my wife, things like that. And I think as physicians, we're so attuned to just taking care of the body that we forget about the mind, which also tends to be a very large aspect of things.
That leads to my next question. Depression, anxiety after a heart attack. So what do we tell our patients?
That it's normal. It's part of the recovery process. There are certain stages that we go through as humans to kind of understand, deal, and cope with different life events. And it's important to be cognizant of it and not be afraid of it, to talk to people about it, and to ask for help if you feel like you need it.
I've had patients' wives coming in with their appointment after their discharge from the hospital that, Doc, my husband doesn't want to get intimate with me anymore. So how do you advise your patients that?
So, happy wife, happy life, right?
Well said.
But I think that having a degree of confidence, and usually that relates to fear, addressing that head on, getting them involved in cardiac rehab, having them get out and get used to getting back into the routine of daily living, kind of distracts the mind. And then slowly with time, you can't rush into things unless, you're the 80-year-old guy that has the 40-year-old girlfriend. But, you know, people, it takes everyone a little different amount of time. So having a spouse that's encouraging and comforting, I think, helps resolve some of those issues.
I think that's an excellent answer. Again, I tell my patients that always listen to your body, all right? You did have a heart attack, you have stents, everything is under control, but listen to your body. If you're feeling a little tired, a little down, take it slow. You will get back to your baseline, but always listen to your body. God is an amazing scientist. God has made our body in such a way it gives you signals. Don't ignore it. So we have talked about a little bit about heart attacks, lifestyle modifications for heart attacks, and we're going to talk about some more interventional procedures that Dr. Rajiv Tayal is doing in the cath lab that is surpassing open heart surgeries. One of the newest technologies that we are seeing is valve replacements without open heart surgery. Dr. Tayal, educate us.
So traditionally, you know, to have your valves replaced, it required open heart surgery. And what that means is basically they would put a breathing machine or a tube down your throat to help you breathe. They would put 2 chest tubes inside of you and then basically split the sternum in half, open the chest in order to surgically excise a valve and then place a new valve in there.
Right.
So this is kind of the size of the cut that the surgeons typically make, as you can see here, to access the heart. On the right here is a patient right after having a valve replacement procedure that I actually did through their axillary artery, which is located in the upper chest and into the arm. What we're now doing traditionally is doing valve replacements either through arteries in the arms or in the legs. Typically the procedures take anywhere between 45 minutes to an hour.
Wow.
And I'd say about 95% of our patients plus go home the next day.
Amazing.
So to demonstrate that, here is a valve that's been advanced over a catheter through the leg artery into the aorta. And then basically what we do is we take a contrast injection to highlight where the aortic valve is, and then we slowly inflate the valve, as you can see it expanding, and it will replace the native aortic valve using the native valve and the calcium there to hold it in place. It will then function as the patient's native heart valve. Initially, when this first came out, probably 12, 15 years ago here in the United States, it was only done for patients that were too sick or too high risk for surgery. But through clinical trials, we found that it was way better than medical therapy. We found it was better than surgery. So then we tested it in patients that were intermediate risk and now low risk, and it's beat surgery in all comers. So it's now one of the most foremost, if not standards of care for aortic valve disease.
That is so incredibly amazing, right? And again, we were just talking about our common patient that you did a valve-in-valve surgery who was doing very poorly in heart failure, and she walks into my office. So that's where interventional cardiology has gone. She wouldn't have qualified for open heart surgery because of her age and other comorbidities, but Dr. Tayal saved her life. Thanks, Dr. Tayal. Next question, for people who are on blood thinners for atrial fibrillation or irregular heart rhythm, and we know in the elderly or some people, they cannot take blood thinners. There is this new device called Watchman Device, which I'm sure a lot of people have seen on TV as being advertised. Dr. Tayal has been doing this procedure, and a few key points on it.
So blood thinners can be a double-edged sword. You know, on one hand, they're necessary to prevent strokes in patients that have irregular heartbeats, because when you have things like atrial fibrillation, there's a small part of the heart called the left atrial appendage, which is where about 85 to 90% of the clot that happens occurs. And then that can be shot from the heart towards the brain, causing a stroke. However, for a lot of patients, they can't tolerate it, whether they have upset stomachs and they start bleeding in the stomach, or they have frequent falls, or they just start bruising uncontrollably. So for a lot of people that cannot tolerate them, this new device was created. It's called the Watchman Device. And so it's actually inserted by going through a vein in the leg. We then come across the chambers of the heart by making a small hole inside of the heart itself and identify the area where those clots tend to form, and then place this device to occupy that space and prevent blood clots from happening. So within 6 weeks of this procedure, people can completely come off of any form of blood thinner. So this is a brief overview of what the device itself looks like. If I was to hold it up, it would probably be about this size overall in diameter. So what you can see here is we've got a camera that's been inserted down the patient's mouth into the esophagus so that we can take pictures echocardiographically. And then I'm injecting contrast through a catheter in the left atrial appendage in order to identify it. So here you can see the shape of it. We see that there's no thrombus or clot in it at the moment.
And another of Dr. Tayal's amazing interventional cases saving lives. Thank you, Raj. I cannot thank you enough for spending your valuable time with us.
Thank you.
Unfortunately, we have to end the show. I wish we could have kept this chat going, but we will definitely have you back. So
Great.
Viewers, don't be disappointed. He'll be back with more amazing office tricks that he does in the cath lab. Again, thank you for joining us on our first brand new episode of Heart to Heart Health Chat. We will be back next week with another amazing and fun episode. We will be talking about high blood pressure or hypertension, how to take care of it with medications, without medications, and I hope to see you then. Bye for now.